Just one, before we introduce the final speaker, who's the Chief Executive of Cranstoun Drug Services, I just want to pick up on what Fintan was saying about Cranstoun locally in Portsmouth. I've been in Portsmouth now about 11 years, and Cranstoun has been an absolute constant partner to us in all that we've done. And while it's always invidious to pick out one organisation, anything like this, I do just want to say thank you to Cranstoun and all that work there. And particularly thank you to Mark. Mark does a huge amount of work with us in Safer Portsmouth Partnership, lots of other venues and so on, and Mark probably is the sort of the person I work with most in terms of, yes, smile Mark, that I work with most in terms of the work that we do across the city. So it's really just to say thank you very much to Cranstoun, and thank you very much to Mark for all of the work that you do. Which is probably an appropriate time to introduce Steve Rossell, who's the Chief Executive of Cranstoun Drug Services.
Thanks very much. Well, first of all, thank you to the speakers that have spoken already, and thank you all for coming today. We've got quite a spread of people from sort of across the city in various roles and with various responsibilities. I always find it a bit bizarre that we quite often in Cranstoun have a launch some months after the start of a service. But it does actually give us the advantage of talking about achievement as opposed to just plans. And what people have sort of hinted at before, and certainly my conversations before the speeches began, was that this was a kernel of an idea that had a huge range of potential barriers, both political, financial, and sort of interagency barriers that could have stopped the idea becoming a reality. This hasn't happened, and what has happened is an awful lot of people from a range of agencies with a range of different agendas have come together with one agenda to provide services for young people for this city, which I think is, I won't say unique, but it is becoming increasingly unique in terms of the sort of localities that we work in. Just provide a bit of information and background about the context that we came into as an organisation. We have been providing services across the city for 11 years now. May 2000, Mark reliably told me the other day, was when we first started providing services. I walked across the square earlier and remembered very vividly going into a particular building when we were actually negotiating that first contract. That was for an adult service. Quite often young people's services in many of the localities we actually work in across the south of England are the sort of very small compared to adult services, and young people's services aren't necessarily well integrated with the range of other provision associated with young people's needs or adult provision. That's very different in terms of the plan and the implementation of this particular service. Yes, young people's provision has always sort of been operating in the city. What tended to happen before though was that it stopped when people were 18. And quite a lot of 18-year-olds weren't accessing any sort of services, particularly not treatment services. And there wasn't a transition between young people's provision and sort of the higher care adult treatment services. And many of the elements of provision maybe had lower numbers than were expected in terms of those engaging with young people's provision across the city and elsewhere and in the locality. That's something that's very different now, and it's not just because Cranstoun are here, because we do not view this as us parachuting in to any locality. What we tend to see ourselves as is trying to sort of airlift people out of some of their situations and complex situations for a while, for whilst they're with us, and actually assist them to tackle, or at least start to tackle, a range of issues that they may be presenting. Which is why the service is designed the way it is. Yes, it's a drug and alcohol service for young people, but we actually tackle a range of issues that the young people actually present to us. And that could be employment, it could be housing, it could be relationship issues, sexual health issues, and a range of other things. But it's actually recognising that that complexity is something that we, working alongside other agencies across the city, can actually start to make inroads into the complex issues that people are presenting. And that's the great idea behind the service. And we just happen to be one of the organisations that are leading the response to that range of needs that are being presented by young people. So yes, we've extended the age group. It goes up to 25. We've also increased access for young people that are sort of younger than 25, younger than 18, and in some cases younger than 15. We've been relatively successful at doing that. We've actually got quite a range. Nearly half the people that are presented to the service are now accessing treatment, and that's half the people that are 18 plus. 15% of the people that actually present to the service are under 15. Now it's great that we're being able to work with that population and they feel able to actually engage with the service, but it just does indicate that there's a range of issues and problems out there, and we are just starting on a process to actually address some of those. So yes, Switch is designed as a transition service for young people and for those that want to go into treatment or access other support and assistance. It's also designed and delivered to make a real impact, which is why we tackle a range of issues and not just concentrate on drugs and alcohol. It's also designed to work alongside other people and other agencies, and only by doing so will we make the sort of impact that we want to make with what is a very vulnerable group, but it's a group that has huge amounts of potential, which has been touched upon before. And making a difference is something that Cranstoun constantly strives for, and I know it's something that a lot of the other agencies and organisations and individuals in the city actually strive for as well. There are a number of thanks that I'd like to sort of make at this point, just to flag up before I sort of touch on that some of the other results. We had a target. Now lots of people have targets and they're aspirational or stretch targets as some people like to call them, but we had a target to reach within this first year of actually to work with 160 young people. 6 months in, and this goes back to my opening comments about talking about achievements, we've actually worked with 96 people already, actively. So we're outstripping what were fairly stretched targets for a brand new service. Of those people, about 75%, about 3/4 are presenting with predominantly drug issues, and about a quarter are presenting with alcohol issues. All of them are presenting with a multiplicity of needs. 15% of that client group are under 15. So if we can actually tackle some of the issues they're presenting to us with at that age, just think of the potential we could be sort of unleashing and releasing for our future and their futures. And thankfully, as I've touched upon before, 47% are over 18, so we've actually increased the amount of people accessing young people's provision that we can then move on to other adult services and other helping agencies. So it is a distinct group and a distinct service, but it's quite an integrated service. It's something I keep coming back to, and it's delivered in partnership. It's the Portsmouth Safer Partnership that has commissioned us and given us the direction and shape, so thank you to them. I'd also like to sort of pick out a couple of other people to thank. Sue Nifton, who's the Commissioner, has been particularly supportive, both in terms of the idea and taking it forward through implementation and all the negotiations associated with that, to its point here whereby we're delivering what I think is an excellent service, so thank you. Also Stuart McDowell, who's the project manager for young people's provision here, and again with Sue has been instrumental in assisting us to actually work in partnership with other agencies and design and deliver the service that we're here to launch today. There are a range of other individuals and groups, and I thank all of them for their part in it. And again, to thank the Safe Portsmouth Partnership for their support financially. It is proof that you can do an awful lot with a small amount of resource. Just wanted to emphasise that. And also thanks to you. Many of you have contributed to the design and delivery of this service up to this point, and also to the young people that have presented and assisted us again in the design and delivery of this service. So thank you for coming today, and I wish everybody involved with Switch all the best. Thank you very much.